Hi, everyone. This is Ashley O'Donnell, Clinical Quality Consultant with the Iowa Healthcare Collaborative. In February of this year, IHC was awarded the support contract for the Medicare Beneficiary Quality Improvement Project, also known as MBQIP, by the Iowa Department of Public Health. MBQIP is the quality improvement activity required to meet the eligibility requirements in the Medicare Rural Flexibility Grant Program. This support contract in Iowa was previously held by Stroudwater. As the new support contractor for MBQIP, hospitals will now request assistance through IHC for MBQIP and FLEX-related questions, and will now receive quarterly MBQIP data reports electronically from IHC. We have taken the opportunity to recreate the MBQIP reports with the goal to make them more user-friendly, visually appealing, and beneficial for hospital use. This is a brief tutorial that will go over the new MBQIP reports that you will now receive. If you have any feedback or further questions, please reach out to your clinical quality consultant. We'll go ahead and get started with the first report. This one is looking at the emergency department transfer communication, which you will see at the top of the screen. It'll tell you your hospital's name, the time frame of the data you're looking at, so Q1 to Q4 2019, and which report you're looking at, Q4 2019. This first box is your hospital's EDTC data by quarter, which is listed out by each EDTC element. So you will see 1 through 7 over your total records, which is your denominator, and your composite. You'll see that listed out for each quarter, 1, 2, 3, and 4 over on the left-hand side. Below that, you'll see 3 red bars. The 2 to the right are the reporting Iowa critical access hospital averages for each element, and the one below that is the reporting national critical access hospital averages for each element. To the left, you'll see some green and red boxes. These are comparing your report to the Iowa critical access hospital averages for Q4 2019 only. So you'll see, for example, this box in red, EDTC number 4 is 90.15, which is comparing it to the reporting Iowa critical access hospital average EDTC number 4, which is 96.10. Therefore, it's red because it is below the Iowa average. The big box on the bottom is your hospital's overall performance compared to all Iowa critical access hospitals, which is looking at your composite EDTC numbers. This is listed out by Q1, 2, 3, and 4, and gives you a visual of where your hospital lies. The second data that you'll be reviewing is HCAPs. So this will be 2 pages long, just based on the amount of questions that HCAPs is reviewing. Again, you'll see the title at the top, your hospital's name, and the time frame of the data you're reviewing. You'll see the number of completed surveys on the top left, which gives you a survey response rate. And then if your hospital does have a star rating, that would be over on the right. You'll see these boxes are all similar in what they are telling you is just listed out by different questions. So for example, the first box is composite 1, communication with nurses, which tells you it's looking at question 1, 2, and 3 on your HCAPs. The data will be shown as always, usually, and sometimes to never, as it is on your HCAPs response. And under each box, each graph, you'll see the Iowa average and the national average for how other hospitals had been scored in this area. This continues all the way through composite 6, and then you'll see the legend over here on the right, which walks you through the boxes, your star ratings, and then the note. If the star rating is listed as NA, it means the number of patients surveyed is too few to report a star rating. As previously mentioned, HCAPs does have quite a bit of information on it, so this report is 2 pages long. The second page is just further questions, and the answers: strongly agree, agree, and disagree. And then again, your legend over here on the right. Third is your inpatient and outpatient quality report. Again, this will have your hospital's name listed underneath and the time frame of the data you're reviewing. Each box here will represent a specific outpatient measure. I'll review OP18, which is at the bottom right of this screen. You'll see in the red box, it'll tell you the name of the measure. So for this one, we're looking at median time from ED arrival to ED departure for discharged ED patients. The box with the graph, with the bar, with the run chart, is looking at your hospital's in particular data for each quarter. So 2018 of Q3 all the way to 2019 Q2, which is also listed out underneath that. So you'll see that the time for quarter 3 2018 was 71, and that was included in 81 patients. Over to the right of the run chart, you'll see the Iowa Critical Access Hospital median time in 90th percentile, followed by the national critical access hospitals and the all national hospitals. Each one of these boxes will give you a little reminder of what the measure description is and what the time and the patients are looking at. There's also a second page of this one, which continues to review each measure specifically. You'll notice some really important notes here on the bottom right. When there is a 0 listed with no data point on the graph, it means that the data that was submitted was excluded because it did not meet the measure criteria. When there is a 0 with a data point on the graph, it means that the provider had no cases to submit. And when there's a blank for a certain time period, it means that the provider did not submit any data to the QualityNet warehouse. Just some helpful things to keep in mind. And lastly, we have the NHSN Patient Safety Component Annual Facility Survey. This one's pretty simple. It'll tell you your hospital, and it'll have each core element of the annual facility listed out 1 through 7, and then a total all elements met. You'll see it'll be a yearly survey. So you'll have 2016, 2017, 2018 in this example one, and you see this sample hospital progressed every year to meeting all 7 in 2018. And it will also show you the Iowa Critical Access Hospital averages and the National Critical Access Hospital averages over to the right. You'll see as a helpful tool on the bottom, each hospital core element is listed, so you can easily review which ones your hospital may or may not have met yet. And those are the new MBQIP data reports. I know this was very brief, but we wanted to give you a quick rundown of what these reports we're looking at. Please let your clinical quality consultant know if you have any feedback, any further questions, any clarification needed, as we would love to walk through these reports with you and discuss as we go. Here's the IHC team. If you need to reach out to any of us, here's our contact information. Thank you and have a great day.